Here's a detailed and organized drug guide for atropine. Generic name, drug class, brand name. Generic name, atropine. Drug class, anticholinergic, muscarinic antagonist. Atropine, isoptoatropine, atreza, saltropine. Definition: is a naturally occurring antimuscarinic agent that inhibits the parasympathetic nervous system by blocking muscarinic acetylcholine receptors. It is used to increase heart rate, reduce salivation and secretions, and treat certain types of poisoning and bradycardia. Hamhirn 3. Mechanism of action. Atropine competitively inhibits acetylcholine at muscarinic receptors in smooth muscle, cardiac tissue, and secretory glands. This increases heart rate by blocking vagal effects on the SA node, reduces secretions, saliva, mucus, relaxes smooth muscles in the gastrointestinal and urinary tract. 4. Indications: bradycardia, slow heart rate, pre-anesthetic to reduce secretions, organophosphate or nerve agent poisoning, ophthalmic use for pupil dilation, mydriasis, antispasmodic for GI or urinary tract, asystole or pulseless electrical activity, PEA, during advanced cardiac life support, ACLS. 5. Contraindications: hypersensitivity to atropine or belladonna alkaloids, glaucoma, especially narrow angle, myasthenia gravis, obstructive uropathy, e.g. benign prostatic hyperplasia, severe ulcerative colitis, paralytic ileus, tachycardia due to cardiac insufficiency. 6. Before taking this medicine, precautions. Inform your healthcare provider if you have glaucoma, heart disease, especially arrhythmias, liver or kidney problems, myasthenia gravis, obstruction in the stomach or intestines, pregnancy or breastfeeding. How to use. Injectable form, IM, IV, or subcutaneous, is usually administered by a healthcare provider. Ophthalmic form, apply 1 to 2 drops into the eye as prescribed. Avoid touching the dropper to the eye. Oral form, take with water, usually before meals or as directed by your doctor. 8. Dosing information. For bradycardia adult, IV, 0.5 milligrams every 3 to 5 minutes as needed. Maximum dose, 3 milligrams. Initial, 2 to 5 milligrams IV IM every 10 to 15 minutes until secretions are controlled. Pediatric doses vary by indication and weight. Ophthalmic use, 1 to 2 drops, 1 to 2 times a day as needed. Doses may vary. Always follow physician or package instructions. 9. Misdose and overdose. Misdose, take as soon as you remember. Skip if it's almost time for the next dose. Do not double dose. Overdose symptoms: dry mouth, blurred vision, hallucinations, hyperthermia, urinary retention, tachycardia, seizures, coma. Treatment. Supportive care. Physostigmine may be used as an antidote in severe cases. 10. Stop or avoid taking if you experience signs of allergic reaction, rash, itching, swelling, dizziness, trouble breathing. You have sudden worsening of glaucoma, severe constipation or urinary retention occurs. You develop confusion, agitation, or hallucinations. 11. Side effects in detail. Common side effects: dry mouth, blurred vision, constipation, urinary retention, dizziness, sensitivity to light, photophobia. Serious side effects: rapid heartbeat, tachycardia, difficulty urinating, severe abdominal pain, eye pain or vision changes, confusion or hallucinations, allergic reactions. 12. Vital information. Use caution in elderly patients. They are more prone to CNS side effects, e.g. confusion. May impair ability to drive or operate machinery. Use sunglasses due to pupil dilation and light sensitivity. Avoid in patients with glaucoma unless specifically indicated. 13. Other drugs that will affect atropine. Drugs with anticholinergic effects, e.g. antihistamines, tricyclic antidepressants, antipsychotics, can increase side effects. Amantadine, quinidine, disopyramide, nitrates may worsen glaucoma. Potassium supplements, increased risk of GI irritation or ulceration. Always inform your doctor about all medications, including over-the-counter drugs and herbal supplements you are taking. Thank you. Have a nice day.